children are watching their little ones very closely now that a troubling virus is making its way across the country. Enterovirus hasn't been detected in Tennessee yet, but as it hits surrounding states like Mississippi and Arkansas, it may just be a matter of time. WREG's April Thompson is live in the newsroom with what parents need to know. April.
Claudia, Tennessee isn't breathing a sigh of relief just yet. We haven't had the enterovirus cases here, but that may be because all lab work from Tennessee hasn't been tested just yet. So whether you live in Tennessee or any other state, the advice from doctors, watch for the signs.
Vessa Mosby tries to stay on top of the vaccines and doctor appointments for her 10-month-old son, Anthony. But word about a new enterovirus that can hit young kids and can leave them gasping for breath throws her for a loop.
Yeah, it does. I mean, he just turned 10 months, and he actually has a little cough and a runny nose, so that just kind of spooked me.
That runny nose and cough may be nothing, but doctors say now with enterovirus going around, you may want to check to be sure.
People may think they have a bad cold, coughing, runny nose, some fever, and it progresses and it's to a more severe form where the children may require hospitalization.
Enterovirus is really just a respiratory condition. It can be especially bad in children since their young bodies haven't become immune. It mimics the common cold, but Dr. Threlkeld with Baptist Hospital says when it flares up in kids who already have things like asthma, it can affect them so bad they may need to go on oxygen or other respiratory support.
It's important for parents with kids with asthma to have a plan in place already. You know, what to do in the case of an outbreak of wheezing, you know, who to call, what medicines to give, those sorts of things.
Dr. Threlkeld says there is no cure for enterovirus. Parents just have to stay on top of their children's breathing. The condition will usually run its course in a few days. Even though enterovirus has been around since 1962, still not a lot is known about it. And it has never spread as fast as it has this year in 27 states and counting.
And like we said, the symptoms of enterovirus are very similar to a cold. And just like a cold, the best way to prevent it, good hygiene, including frequently hand washing and making sure to cover your mouth when you sneeze. April Thompson, WREG News Channel 3.
All right, good to know.